everyone, so let's move towards our today's topic, which is the topic that is temporal fossa and infratemporal fossa. So first we will gonna talk about temporal fossa. What is temporal fossa? Temporal fossa is present on each side of the skull in the temporal region, okay, and you can easily see the temporal fossa from the norma lateralis, that is lateral view. Okay, the lateral view of the skull, you can easily see the temporal fossa. Now, as the name indicates, fossa means hollow like structure, hollow space, okay, and in the temporal region, near the temporal bone, it is present. That's why it is called as temporal bone. Now what you have to remember, the content, you have to remember the boundaries of this fossa. The boundaries are anteriorly anteriorly zygomatic and frontal bone is present. Superiorly, superior temporal line is present. Posteriorly, inferior temporal line is present. Okay, now if you see like I said, from the lateral view of the skull, you can easily see the temporal fossa. So posteriorly inferior temporal line होगी, superiorly superior temporal line होगी, anteriorly frontal or zygomatic bone, and the inferiorly zygomatic arch will be present. Okay, zygomatic arch will run inferiorly and it will form the inferior boundary of the temporal fossa. The roof is formed by temporal fascia, because the whole temporal fossa is covered by a muscle, which we will gonna talk about after a few minutes, but that muscle is temporalis muscle, and above that the whole temporalis muscle is covered by a fascia, that is temporal fascia, and above that temporal fascia the skin is present. The floor of the temporal fossa is formed by pterion. Okay, now what is pterion? Pterion is basically the meeting point of frontal, parietal, temporal and sphenoid bone, which is present in the temporal fossa. Okay, now moving further, what are the contents? Now we are just memorizing the name of the content, that is temporalis muscle, which is the muscle of mastication. What are muscle of mastication? Muscles of mastication is basically a group of muscles which help in the movement of mandible. Okay, as you know, the mandible is basically the bone, is the only bone. Mandible is the only bone of the skull which is movable. Okay, so the movement of mandible take place through a group of muscle, and that group of muscle is called as muscles of mastication. So among those muscles of mastication, temporalis muscle is present, which is the content of temporal fossa. Middle temporal artery is also present, temporal nerves are present in temporal fossa, and deep temporal artery is present in temporal fossa. If I talk about infratemporal fossa, okay, like I said, temporal fossa and infratemporal fossa are the topics of today's lecture. So infratemporal fossa basically क्या होता है? It is present below the temporal fossa. That means that superiorly, that infratemporal fossa is connected with the it will communicate with the temporal fossa. Okay, infratemporal fossa is basically irregular space present on each side of the pharynx. Okay, and like I said, it will communicate with the temporal fossa. You have to remember the boundaries as well as the content. So anteriorly mandible bone is present, posteriorly mastoid part and the styloid part of the temporal bone is present, superiorly, S for superior, S for sphenoid. Okay, superiorly, or the roof of the infratemporal fossa is formed by greater wing of sphenoid, and inferiorly the angle of mandible is present. I have already uploaded the lecture of the mandible bone. So if you listen or if you watch the lecture of the mandible bone, you can easily memorize it, that what is angle of mandible. So angle of mandible is present inferior to the infratemporal fossa. Medially, lateral pterygoid plate is present, okay, and laterally the infratemporal fossa consists of ramus of mandible, okay. So rami of the mandible are present laterally, and the lateral pterygoid plate is present medially to the infratemporal fossa. What are the content? Lateral and medial pterygoid muscle are present in the infratemporal fossa. Mandibular nerve is present. Maxillary nerve is present. Maxillary artery is present. Pterygoid venous plexus is present. Pterygoid venous plexus is the obviously venous drainage. Now, before ending this lecture, I would like to tell you something, that I've told you the contents of the infratemporal fossa and the temporal fossa, that is maxillary artery, mandibular nerve, and muscles as well. So muscles are basically included in the muscles of mastication, which is another lecture which I have recorded separately. So you have to listen that as well. You have to listen the maxillary nerve, the lecture of maxillary nerve as well. You have to remember, you have to watch the lecture of maxillary artery as well. So in short, तमाम कंटेंट्स, जो भी कंटेंट्स हैं उन सब की सेपरेट रिकॉर्डिंग्स हैं, जो आप उस सेपरेट लेक्चर्स हैं जो आपने सुनने हैं, देखने हैं, समझने. ओके, सो दिस वाज द होल टॉपिक. यू हैव टू रिमेंबर. टिल देन, वर्क हार्ड, स्टडी हार्ड, एंड गुड लक. टेक केयर.